Hi everyone, Dr. Erin here. I'm a doctor of audiology and I'm here to show you what to expect when you get your hearing tested. This is a sound treated booth. This is what we test people in. We usually have our equipment out here called our audiometer. It's going to give us the information we need about your hearing. When you come in the booth, of course we have an otoscope here. You'll have a seat in the chair. We'll go over some history, check your ears, make sure there's nothing in there such as wax that could impede us from testing you. And then we're gonna hook you up with some of the insert headphones. Those little yellow pieces can go inside your ear. I know a lot of people have used these headphones, but in my clinic, I prefer the insert. And then you're gonna have a button here. You'll see your button. You'll press that button every time you hear a beep. After we complete that test, we'll also do some speech testing. We'll have you repeat some words. There's going to be sentences for you to repeat back sometime. And then you're going to have this bone oscillator next. That is going to show us how those nerves are hearing. Next, I'll show you what to expect when we go over the results. This is your ear, and when we use the headphones, we are testing how the sound travels from your outer, middle, and inner ear. Your outer ear is going to be this pinna of your ear, and it goes all the way to your eardrum. And behind your eardrum, you have those little bones. You have an open air space behind there. That is your middle ear. And then your inner ear is where your cochlea is. It's where the nerves are to your ears. So when we test with the headphones, it goes through all three portions of the ear. When we use that bone oscillator I showed you, we're vibrating the bone behind your ear, and it skips the outer and middle ear and goes straight to the inner ear. So that's going to show us what type of hearing loss you have, whether it's a nerve type of hearing loss, which we call sensory neural, or if it's a conductive issue or mixed hearing loss, which would be more of a mechanical or medical issue. And then we'd have to send you to an ear, nose, and throat physician to have that looked at. Next step is I take patients to my office and I will sit this sheet of paper in front of them. This is their hearing test, and I'm going to go over the results with them. So on your audiogram, you're going to see soft sounds to louder sounds, and then low pitches to higher pitches. The circles are the right ear, the X's are the left ear. And I do have a chart down here that will give you a key to what those marks are. So when we look at this graph, it has normal hearing up here. Then we have mild, moderate, moderately severe, severe, and profound. And I'll go over the hearing test and show them what their thresholds are, where they're hearing those beeps. The other thing that we'll go over is the speech testing. So you have different words that you'll have to repeat back. This person got 100% on both sides. And then we will just go over situations that they might have problems in and explain why they're having hearing difficulties. I hope this video helps you understand what a hearing test is and what to expect when you go in. See you next time.